I'm Fahad Saeed from the University of Rochester.
And I am Paul Duberstein from Rutgers University. Together, we will present the findings of our research study, Dialysis Regret, Prevalence and Correlates.
Regret is a powerful human emotion, and unfortunately is too common in dialysis patients. However, little is known about why some patients experience regret with the decision to start dialysis.
To answer this question, our research team surveyed nearly 400 maintenance dialysis patients. In response to the question, do you regret your decision to start dialysis? 21% reported regret.
Then we examined whether regret was more common in men versus women or whites versus blacks, but no demographic differences were observed. We found that regret was more common when patients reported choosing dialysis to please doctors or family members.
We also found that regret was less common when patients reported discussing their prognosis, including life expectancy, with their doctors. Regret was also less common when patients completed a living will.
Based on our findings, we suggest that nephrologists engage patients in shared dialysis decision-making and end-of-life planning. Sharing of prognostic information should be a part of these discussions, recognizing that some patients may not be eager for this information.
In closing, you may want to help patients think of dialysis as a major life decision, one with wide-ranging consequences. If you believe they are consenting to dialysis to please you or to please their family members, our study suggests that they might regret starting dialysis.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.